my name is Raven Johnson, and today I will be giving a presentation over my chemistry internship. It was a 2-hour internship with 100 hours of shadowing. So I did my chemistry internship with Southern Equine Veterinary Services. This service is based in Noblett, Kentucky. It is owned and operated by Dr. Deanne Hughes. Now, as implied by the Southern Equine name, this practice mainly services horses. However, during my internship, we did quite a bit of work with cattle, and we also spent a day covering a small animal practice. Instead of discussing everything that went on during my internship, which would take too much time, I'm just going to cover 3 cases that I found incredibly interesting and that also have quite a bit of variability to them. So case 1. Case 1 was a 5-day-old filly, so a female young horse. This is her right here. This is before she became sick. So her symptoms were sudden onset lameness, which was likely due to bacteria attacking her joints, high-grade fever, scalding diarrhea, and just overall lethargy. So our diagnostics, we ran a stable lab, which is IDEXX testing. This tests the SAA, or the serum amyloid A, in a horse. This is a major inflammatory response protein in the liver, and it specifically responds to an infection that causes inflammation. So this test is neat because it takes about 10 minutes to run, and we can run it right then and there. A normal test in a healthy horse will range somewhere between 0 and 10. This foal's test result was 1,648 micrograms per milliliter, so that let us know there was definitely an infection present. We also collected blood to send blood work to the University of Kentucky, but this foal's, she was so dire that we weren't going to have time to wait to get the results back from that testing. So based on her symptoms and the stable lab testing alone, we decided that she likely had an infection of Clostridium perfringens, and so we started treating her with broad-spectrum antibiotics, amikacin, metronidazole, and Naxil, and then we coupled those with probiotics and IV fluids just to keep the foal hydrated, to try to combat the bacteria, and just overall try to keep the microflora in her gut established. So the blood work did come back from the University of Kentucky after about 3 days. It confirmed that the foal was positive for Clostridium perfringens. It also showed us that she was positive for Salmonella. Now, I don't really want to get caught up on the Salmonella diagnosis because this was likely just a secondary infection that resulted from the shedding of the Salmonella through the dam or the mother of the foal's milk. This was likely due to stress. There's currently studies that are being conducted on that etiology, but nothing is confirmed yet. So the University of Kentucky also did an antibiotic panel, and this antibiotic panel tested the antibiotics that the bacteria was resistant to. The panel showed that the bacteria was resistant to amikacin, and so we switched the foal from having amikacin to having doxycycline, which the bacteria was not resistant to. So the prognosis for this foal was favorable but guarded. After the first 24 hours, we felt that the foal was likely to survive this infection, but we say favorable but guarded just because there may be, from the joint swelling, residual lameness for the rest of this horse's life. Based on our last examination, there was slight lameness left, but we feel that the foal will likely outgrow this. So case 2, and case 2 is where it gets a little nasty, so just prepare yourself. So this gelding presented, obviously, with an issue. The owner complaint was actually improper urination. Now, when we get an improper urination complaint, we usually assume that it's a bean, which is a buildup of smegma in the lower part of the penis, which blocks the urethra and keeps the gelding from properly being able to urinate. Clearly, he had much bigger issues than that. So upon examination, there was an enlarged penis with necrotic tissue. So we recommended initially that this owner take this horse to a surgical facility where they have the technology and the capability to better deal with something so large scale as we thought this was. Initially, we thought it was the penis itself that was affected, but we were happy to find at the end of the surgery here, which I have pictured, we have all the sutures in place and everything, that the horse actually, it was actually the sheath which surrounds the penis and not the penis itself that was affected. So this was good because that meant we didn't have to reroute the whole urinary tract, and instead the gelding can continue to use his urethra to pee. So we took him and we performed the surgery in the field with Dr. Angie Olt. Dr. Angie Olt was the primary surgeon just because Dr. Hughes was monitoring the anesthesia. So for the anesthesia, we did a triple drip anesthesia, which is a combination of xylazine, ketamine, and guanfacine. Guanfacine is used in horses because it's a central acting skeletal muscle relaxant, and it binds to the specific inhibitory neurotransmitter receptor sites in the brain and spinal cord. So this horse actually was down and under anesthesia for about 2.5 hours. So the prognosis for this horse, especially since it was not the penis itself that was involved, instead was the sheath, is favorable. There is some swelling right here from after the surgery, but that's all normal suture right here. He actually was able to pee properly once we had finished the surgery, and last we talked to the owner, he was eating normally, peeing normally, and just overall just enjoying his life. So case 3 here, and case 3 I came on to after Dr. Hughes had performed the initial diagnosis, but it's still an interesting case just because it's so long term and there's so much that goes into it. So this horse, she had previously been diagnosed by Dr. Hughes with laminitis or founder. Now laminitis is the breakdown of laminae, which sit right here in the hoof, and this is due to, it can be due to a rush of carbohydrates from like a feed that's high in it, or sometimes in the spring we'll see this happen more often because the grass is so full of it, but it can also be due to concussion, like in horses that are ran on pavement. And so that just breaks down the laminae, and so instead of the laminae holding this coffin bone up here, which we also refer to as P3, it allows it to drop. And so instead of the P3 bone sitting like this, it starts to rotate like this. And so for this mare, we use X-ray diagnostics to determine how much rotation there is and to also develop a corrective farrier plan, which will help to raise the bones back to their proper levels. So diagnostics, again, just X-rays, treatment, so corrective and proper farrier shoeing. And then we also have this mare, she takes 1 Equiox pill a day. Equiox is kind of like the equivalent of ibuprofen in humans, but it can be taken every day and not affect the liver. We also do diet monitoring because this mare is a little bit overweight. Overweight horses tend to founder more frequently, so we reduce her diet, make sure it's not full of carbohydrates, and try to keep any more laminae from breaking down. So this is the x-rays in the mare itself. These are hind end x-rays. Initially, Dr. Hughes told me that the mare was highly lame and mostly foundered in her front left hoof, but when we took our x-rays, she was mostly foundered, had a bigger rotation, I should say, in her back right. So a compensatory founder where she's compensating for the front left to the back right, because horses, they're diagonal is how they respond, so they move that way. So this back right is compensating for her front left, and as you can see, here there's slight rotation, but even the untrained eye can see there's more rotation here in the P3. You can also see that the cartilage between P2 and P3 has some breakdown, and so this rotation right here is also affecting the navicular bone, which is back here. You can also tell, although these x-rays aren't like taken at the exact same angle, that the sole right here, based off the nails, is thinner than the sole in this x-ray. And so what the farrier is trying to do is raise these bones back up and keep the hoof itself off the ground so that the sole doesn't wear down anymore. Because as in this last picture here, you can see that in severe cases, P3 can drop all the way through the bottom of the hoof, and this is clearly very painful. It can also lead to bacterial infections and most likely results in a euthanasia. So our prognosis for this horse is favorable, based mainly on the fact that her owner is willing to follow a diet plan and get the farrier out there, and the farrier is willing to work with the vet to to properly shoe this horse and hopefully establish a better sole and rotate the P3 bone back up. And here are my references. Thank you very much.